Dear viewers, as part of the online video presentation, we have been doing the dissection of the infratemporal fossa and structures present in it, muscles of mastications and other structures. Today we are going to discuss about the maxillary artery. The maxillary artery is one of the terminal branches of the external carotid artery, and this termination occurs behind the neck of the mandible. The artery passes deep to the neck of the mandible, between the mandible and the sphenomandibular ligament, towards the lower border of the lateral pterygoid muscle. Then the artery runs over the lateral pterygoid muscle and then finally disappears from the infratemporal fossa by passing through the pterygomaxillary fissure into the pterygopalatine fossa. And the artery is divided into three parts by the lateral pterygoid muscle. From the beginning to the lower border is the first part, which is deep to the neck of the mandible, and it is called the mandibular part. And this part over the lateral pterygoid is the second part of the maxillary artery. Sometimes the second part may be deep to the lateral pterygoid muscle also, and then the third part is in the pterygopalatine fossa. It enters the pterygopalatine fossa by passing through the pterygomaxillary fissure, by passing between the two heads of the lateral pterygoid muscle. Now let us see the branches of the various parts. The first part, of course, this is the beginning of the first part, and this is the superficial temporal artery. Here is the maxillary artery. It gives off 5 branches. Of these 5 branches, 4 branches are going upwards and only 1 branch is going downwards. The 4 branches which are going upwards are the deep auricular artery, the anterior tympanic artery. The deep auricular artery goes upwards and backwards to supply the external acoustic meatus and the external surface of the tympanic membrane, whereas the anterior tympanic artery is a tiny branch which enters the middle ear cavity by passing through the petrotympanic fissure and supplies the inner surface of the tympanic membrane. And the other one is a large artery, which is, this artery is a middle meningeal artery, which passes between the two roots of the auriculotemporal nerve and enters the cranial cavity by passing through the foramen spinosum to supply the meninges, especially the dura mater and the cranial bones. You may find another which has not been traced, that is the accessory meningeal artery, which may be a direct branch from the first part, or sometimes it comes from the middle meningeal artery. That tiny accessory meningeal enters the cranial cavity by passing through the foramen ovale along with the mandibular nerve. And this branch which is going down is the inferior alveolar artery, which enters the mandibular foramen along with the inferior alveolar nerve and enters the mandibular canal to supply the mandible. So these are the 5 branches from the first part of the maxillary artery. I repeat the branches: the deep auricular, anterior tympanic, middle meningeal, accessory meningeal and inferior alveolar artery. The second part of the maxillary artery is this one, which is over the lateral pterygoid muscle, especially over the lower head of the lateral pterygoid, and this gives off muscular branches, 4 muscular branches. You have the deep temporal artery, they are 2 in number, anterior and posterior, and also you have the masseteric artery, the buccal branch, and to the pterygoid muscles you have pterygoid branches. So all the 4 branches are muscular in nature. The deep temporal, masseteric, buccal and pterygoid branches. The last one is the third part, which is not been dissected out. Only you can see the beginning of the third part can be seen here in the pterygomaxillary fissure. Before it enters the pterygomaxillary fissure, it gives off branches known as the posterior superior alveolar arteries, divides into tiny branches to enter the foramina on the posterior surface of the body of the maxilla to supply the maxillary air sinus and also the molar and premolar teeth. Then there is another branch which is given off before it enters the pterygopalatine fossa. That branch is the infraorbital artery. The infraorbital artery, if you trace it forwards, it runs forwards and it enters the orbit through the inferior orbital fissure and lies in the infraorbital groove and infraorbital canal. And it gives off an important branch as it runs in the groove and canal, that is the anterior superior alveolar artery, which supplies the incisor teeth and canine and also part of the mucous membrane of the maxillary sinus. So the infraorbital artery runs like that and divides into branches to supply the lower eyelid, nose and the upper lip, which we have seen in the body here. Here is the infraorbital nerve and vessels over there. These tiny branches are given off here and it runs through the floor of the orbit to come out through the infraorbital foramen. And then these two branches are corresponding to the branches of the maxillary nerve and the other branches are corresponding to the branches of the pterygopalatine ganglion. Namely, there are branches going downwards from here, the branches are coming down greater palatine artery, which comes out through the greater palatine foramen on the hard palate. And when it runs down, it gives off small branches posteriorly. They are lesser palatine arteries, which are coming through the lesser palatine foramina over here. So you have greater palatine arteries are there, which are descending branches. And there are posteriorly running branches are there, posteriorly running. They are tiny branches. They are the pharyngeal branch and the pterygoid artery, pharyngeal artery and pterygoid artery. Pharyngeal artery passes through the palatovaginal canal, whereas the pterygoid artery passes through the pterygoid canal to supply the cartilaginous part of the auditory tube and the nasopharynx. The main important branch of the third part is a continuation of it, which is called the sphenopalatine artery, which actually goes medially through a foramen on the medial wall of the pterygopalatine fossa, that is the sphenopalatine foramen, and through which it enters the nasal cavity, where it divides into septal branch and the posterior lateral nasal and medial nasal branches to supply the nasal cavity. One of the medial nasal is a long one, okay, which accompanies the nasopalatine nerves, and then it finally comes out through the incisive foramen over here. Okay, so there are 6 branches given off from the third part of the maxillary artery, which we will see when we do the pterygopalatine ganglion. With this, we have come to the end of the dissection on the maxillary artery. Thank you very much for watching.